Hi everyone, my name is Lillian Zeman, and today I will be discussing the issues of pancreatic cancer in the elderly population of the United States. Pancreatic cancer is an aggressive form of cancer in which malignant, also known as cancerous cells, form in the tissues of the pancreas. The cancer in the pancreas could be an exocrine or endocrine cancer, which is important to know because they can have different risk factors and causes, have different signs and symptoms, are treated in different ways, and have different outlooks. Exocrine cancer is by far the most common type of pancreas cancer. The risk for pancreatic cancer increases as people age. Almost all people are older than 45, with 2/3 being at least 65 years old. The average age at the time of pancreatic cancer diagnosis is 71. Pancreatic cancer is considered an orphan cancer because it has a relatively low incidence. Even with early diagnosis, the mortality rates are high, which despite the low incidence, it ranks 8th in a world listing of cancer mortality. The burden of pancreatic cancer is greatest in developed countries, where almost 2/3 of all deaths occur. It occurs in more males than females, with there being approximately 120,000 yearly male deaths compared to 107,000 female deaths. Pancreatic cancer occurs mostly in individuals, with only 10% of patients developing a tumor below the age of 50. Rates of incidence increase rapidly with age, as seen in data from the U.S. As the population of developed countries ages, we can predict an increasing number of patients that will require treatment for pancreatic cancer. There are many risk factors that may lead to the elderly in the U.S. developing pancreatic cancer. Extensive tobacco smoking over a person's lifetime leads to an increased risk of them developing the cancer. It was thought that caffeine drinking and alcoholic beverages over time would lead to the disease. However, these factors are not associated with pancreatic cancer. Other major risk factors include diabetes, pancreatitis, and cholelithiasis, which is the formation of gallstones. $65,500. This is the average amount a pancreatic cancer patient spends on their treatment. This average of the total direct medical cost of care for pancreatic cancer patients ranks at the lower end of the range of cost estimates reported for other cancers. However, survival rates for other cancers are typically much longer, so pancreatic cancer patients are incurring substantial costs in a very short period of time. Hospitalizations and cancer-directed procedures account for the largest fraction of healthcare costs in the United States. The federal program Medicare pays for a substantial fraction of associated costs of pancreatic cancer. The economic burden of pancreatic cancer in the elderly population is substantial. Certain demographic trends, greater use of targeted therapies, and possible implementation of screening strategies are likely to impact treatment patterns and costs in the future. The rate of pancreatic cancer incidence per year, accounting for the changing demographics, is expected to continue to grow rapidly in the United States. There is expected to be 43,000 incidences of pancreatic cancer in 2030, which can be compared to the 22,000 incidences in 2010. Pancreatic cancer remains to be a challenging problem within our society. Improvements in early detection, screening, and staging of patients will be expected to facilitate progress in the management of patients with this disease. The most promising aspect is the potential we will have to base treatment on our evolving understanding of the molecular biology of pancreatic cancer. A critical requirement for progress will be the development of effective treatments that are capable of reversing the aggressive biology of this disease. So what can we do to alter the outcome of this special population? We can recommend screening for pancreatic cancer from age 45 to 70 so that the tumor can be identified early. By having this early diagnosis, most patients will be able to undergo cancer-directed surgery to have the tumor removed. For the other patients whose tumors might not be able to be removed due to their extensiveness, they can begin radiation or chemotherapy to decrease the size of their tumor. Patients who get their diagnosis early are able to receive treatment and have a 2 times greater likelihood of surviving. Here are some questions for you to think about. What are some primary, secondary, and tertiary levels of prevention that we can implement to decrease the number of people in the U.S. that suffer from pancreatic cancer? And what do you think are some reasons as to why pancreatic cancer is more of a burden in developed countries than in underdeveloped countries?